Okay, so hello, I'm Mark Kelly. I'm a physiotherapist since 2004. Obviously, I practice martial arts since I was 7, taekwondo under Grandmaster Ellis. I still train with him. Um, Aikido, kickboxing, boxing, all manner of martial arts. And I just wanted to talk some short videos on the importance of looking after your body and what's happening at the joints of the body, um, kind of more specifically, and why it's important to maybe go to someone such as myself or osteopath chiropractor who knows how to get these joints working properly. And I'm just going to make a short video today as just an intro, but we're going to go through different body parts and look at kicking and actually what's going on at the sacroiliac joint, the hips, the lumbar spine, so you'll understand if it's not moving properly, compensation is going to occur. And I see many people ending up with knee issues, hip problems, total hip replacements. So I'm just trying to sort of shed some light, because I haven't really seen much out there on on movements of these joints and why it's important to maybe know about this. So just a quick video today on, for example, let's take the front kick. So when we're coming up into front kick position, what's actually going on at the pelvis and the sacroiliac joint. So if I bring you in a bit closer, so this is the skeleton, this is the sacroiliac joint here, and this is the pelvis, the ilium. This joint here, it's debatable if there's movement. There's some people say that there's not movement at all, but I see clinically, if this part isn't moving properly, you'll get compensation elsewhere. And I believe by freeing this part up and knowing about kind of the movements of this, you can prevent this whole area, hip, sacrum, lumbar spine, is interrelated. And I find clinically when I assess people with hip issues, they usually have a sacrum issue and a lumbar spine issue. When we kick, this motion is going to go. What's actually happening is that, let me put this back down here so I can demonstrate. So this is the pelvis. When we're coming up into front kick, obviously you need motion in the hip here, but there's also a small amount of movement in the sacroiliac joint. And this is the sacrum, this is the ilium. There should be this backward movement. So this one moves forward, this one moves backwards. So there's a test we can do, which I can show you, where we fix on S2 here, and we come under the posterior superior iliac spine here. And when the person flexes their hip, so like we'd flex into front kick, or come up into side kick, any of the kicks, there should be motion here. So this hand should go down, this should come up. If it doesn't and it's stuck, if this joint's not moving right, you don't get this nice movement. It just locks out. And I think clinically, when this occurs, other joints, this is the lumbar spine, L5, or the hip, has to adapt and compensate. So we always think about, when we're kicking, do you have movement in the hip, which I'll talk about soon, but this motion is important, and there's different ways of getting it to move. There's different ways to get this joint to decompress and move better, and that's kind of more specific treatment techniques, but I just want to educate people that they can do simple tests, and I'll get someone and I'll show you if we can fix. You just got to know a bit about anatomy. So we come here, and it's called the stalk test. I won't get too complicated because there's an upper part of the joint and a lower part of the joint, but both parts of those joints need to be moving. So it's not just hip movement, there's a little bit of sacroiliac joint movement, and there's some lumbar spine movement here, which we'll go on to talk about. But it's one of the reasons why, when you're training, you should maybe go and get scanned to see how much motion you have in your hips, various motions of the hips, but also the sacroiliac joint and the lumbar spine. So I'll stop there now, and then I'll kind of demonstrate these movements on someone. But yeah, so just to recap, sacroiliac joint, here we go.